Have you ever had a relatively relaxed client with chronic headaches that come and go but never fully resolve? You might be dealing with referred head pain from neck ligaments, a condition that's often misdiagnosed and not treated properly. If you know how to spot it, you can change the game for your clients and get them results that last. Let's dive in. First, when a client's head hurts, they naturally call it a headache. In addition to muscle tension headaches, migraines, cluster headaches, rebound headaches, and post-concussion headaches, there are many other reasons why a person's head can hurt. One of the most frequent and commonly misunderstood is a referred pain headache from injured ligaments in the neck, which manual therapy can efficiently and successfully treat. Second, there are 9 ligaments in the neck that refer pain to the head. Referred pain means the injury is in one place and the pain's in another place. The ligaments that refer pain to the head are the 3 uppermost posterior and lateral cervical ligaments that hold your vertebrae together. You can only touch 6 of them because the upper ligaments that attach to the C1 processes are too deep to palpate with your hands. They require a different kind of treatment. If you put your fingers on your uppermost spinous processes, you can feel the 2nd and 3rd posterior ligaments that go from vertebrae to vertebrae. If you are on or in between the spinous processes, you are on the ligaments. Injury to these ligaments can cause referred pain to the head, usually getting more intense and then less intense depending on the stress in the client's neck. Now put your fingers on the mastoid processes just below your ears. Then go down about an inch and press your fingers toward one another. You're going to hit a hard stop. Now this is the first transverse process that you can feel. And then as you move down, you can touch each one, including the 7th transverse process here at the bottom. The ligaments that hold these transverse processes together are the intertransverse ligaments. Injury to these upper intertransverse ligaments can cause pain at the sides and back of the head, including the temples and occipital area. These headache-like pains get slightly better and worse with various movements of the neck. Third, when the head hurts for any reason, the muscles of the head react in the only way they know how, by contracting, which further exacerbates the pain. 3 main muscle groups add to the pain: the suboccipital muscles, the occipitalis, and the temporomandibular muscles, including the masseters and pterygoids. There are 8 suboccipital muscles at the back of the skull. Then you have the occipital muscles at the back of your head on the occipital bones here, and the temporomandibular muscles at the sides of the head. When you have pain in your head coming from injured ligaments, some or all of these muscles chronically contract and often have to be treated as well. Fourth, the ligament treatment to reduce adhesive scar tissue in the ligaments is done gently and slowly, usually twice a week for 30 minutes. As the adhesive scar tissue is reduced, the muscles generally relax on their own. The client is given simple exercises to prevent the scar tissue that you remove from returning. The more the client does their exercises, the faster the treatment progresses. If muscle tension accumulates in the occipitalis and the suboccipital muscles, and they don't let go on their own or with massage, the client can try the neck relaxer. This is a device that I developed about 50 years ago that accelerates the elimination of chronic tension that has resulted from the constant stress of referred pain to the head. It's called the neck relaxer, or more commonly, Ben's block. It was developed in collaboration with a psychiatrist who worked extensively with the body. Regular use relaxes the head and neck muscles, helping relieve the tension associated with headaches. Fifth, how does it work? When sustained pressure is applied at or near a muscle attachment, it temporarily increases the tension in that muscle. This causes slight discomfort and sends a message to the brain saying, "Danger, relax the muscle." This device tricks the brain neurologically by mechanically, temporarily increasing the contraction in the muscle. There must be some mild, momentary discomfort to make this work. This is an essential part of the process. Many relaxation devices on the market extend the neck in slight traction and may feel good at the moment, but do not have this effect. In contrast, Ben's block gets at the root of the tension instead of short-lived relaxation. This triangular wood device has 3 edges. The first one is round, The second one is semi-round, and the third is kind of sharp. And if the client's neck is relaxed, even the sharp edge causes no discomfort whatsoever, and it feels good. If the neck is tense, even the rounded edge causes some discomfort. After using the neck relaxer regularly, there's no discomfort on the sharpest edge. This device works to neurologically retrain the occipitalis and suboccipital muscles into a relaxed state. Over about a 6-week period during the treatment process, thousands of people have successfully used this device for decades to relieve neck tension and headaches. Of course, if the person has severe headaches, this tool aids in the treatment process. It doesn't do it by itself. The device comes with a complete set of instructions and an online instruction video. If this video helped you think differently about treating headaches, chances are other massage therapists could benefit from it too. Share this video with a fellow therapist who struggled with tricky headache cases. They might be missing the real cause, like so many others. And if you want to keep sharpening your skills, be sure to subscribe for more insights on pain assessment and treatment. See you in the next video.